I think the fact is that we are starting to realize that there are more and more people who may have been infected and even be shedding the virus, but are not exhibiting any symptoms. Or they may be infected and may go on to, say, have a few cold-like symptoms or very mild symptoms and not even recognize it as a problem. But during that time, before and during those mild symptoms, they may be shedding virus. And the percentage of people who are infected who don't have symptoms or have mild symptoms, we really don't know, because we don't generally test people who are perfectly fine and going about their business. So, but we think it may be anywhere from 20 to 50% of people, depending on the population, of those who are infected who are having mild or no symptoms. So I don't think one can say it's rare. It's probably occurring to a significant degree. What that exact number is, we don't know, but I don't think it's rare.
But what that means to me is that I could be around people that appear completely healthy and well. They could be shedding virus and potentially giving it to me.
Absolutely.
Yeah. Is that one of the things that makes COVID-19 kind of unique as a virus, is its ability to have somebody who is infected not showing symptoms but still get other people sick? Usually you get people sick when you're showing the symptoms.
Or right before.
Okay.
I think this is one of the things you may remember back about 15 years ago when SARS, the original epidemic occurred, that there was actually fairly limited transmission, and most of it occurred from very sick people in the hospital. And that is thought to be perhaps one of the differences between then and now, is that there is more transmission before people are very, I mean, if you're very, very sick and you're in the hospital, you're not out and about giving it to people at the grocery store. Mm-hmm. Whereas that's clearly going on here, I think. And so that's probably one of the reasons that we've had such a worldwide pandemic with a lot of spread and a lot of disease, because transmission is easier and it may well be occurring before people are sick or not so sick. I think it means that the risk of getting infected is, generally speaking, higher in the community. Mm-hmm. There's no question. And there have been a couple of pockets, outbreaks, one at a particular, I believe, a meatpacking plant, and there was another one at a residence for people who were sick or infirm. And so that can give you a spike, within a few days. But there's no question that overall our test percentage, positivity, the number of tests that are positive out of the number that are done, has been going up. It's like 9%.
Yeah.
And the estimated reproduction rate, which is basically the number of people that an infected person is going to infect, is estimated to be over 1. We're actually, I believe, the second or third highest in the nation in terms of that transmission measure. So I think we're definitely seeing more community transmission. The bright spot is that we have not had a lot of hospitalizations. Those aren't accelerating. And we've had a very good, low percentage of deaths and hospitalizations. And we're not predicted to exceed our hospital capacity anytime soon. So those are good things. I believe so.
And I should pay closer attention to these things that we've talked about before: hand washing, not touching your face, wearing a face covering, physically distancing, those sorts of things.
Right. So before you go on, we should tell our viewers that the reason that you and I are not wearing a mask right now is so that they can hear us properly and see our faces as well, but that we are sure to be more than 6 feet apart, and we're sitting in a well-ventilated, large area. We're the only people in here without a mask, and we're going to put our face coverings back on and sanitize our hands as soon as we're done with this interview.
That's right.
And we would never be sitting here without masks if it weren't for the fact that we're on a live stream. It is important. And to get back to your point about there being more transmission now. I think this is something that may have been, at least I haven't seen it emphasized in the media. I think it's really, really important that, I mean, it may seem obvious and a lot of people may already know this, so I apologize if I'm telling people something that they know. When you go from red to orange or orange to yellow in terms of social distancing and restrictions, what that is a decision. It's a societal decision that we need to get people back to work, that we need to have some semblance of normal functioning in society, not have people go stir crazy, and keep the economy going. But what it actually means is not that the risk is decreased. In fact, the risk is increased. When we go from orange to yellow and we say that, go ahead and relax some of these restrictions, go out and mingle more, maybe go to eat at a place outside, what that really means is that the overall risk for us of transmitting disease goes up. So when we go from orange to yellow, we should be much more careful, if that's possible, in terms of wearing masks, in terms of washing our hands, and all those things you talked about. So anything that we can do to decrease the possibility that we're going to give it to somebody or that they're going to give it to us, that needs to be enhanced when we go from orange to yellow. Our risk is going up, as evinced by the fact that our cases are going up. And so we need to do everything we can. We need to be even more careful, not less. Yeah. And I think when you hear, oh, we're going from orange to yellow or yellow to green, that means put your foot on the accelerator. It actually doesn't mean that.
It means, yeah.
When you see a yellow light, as a policeman once told me, that means slow down, not speed up. I think the risks in an office environment are basically the same as the risks anywhere, which is proximity to more people. I mean, right, it stands to reason. If you were completely isolated in a cave, in a bubble, then you couldn't get it. Mm-hmm. If you are isolating at home with just your immediate family and nobody goes out and mixes in public, as long as nobody in that family is infected, then you're essentially safe. If you interact with one person who goes to work and comes back, there's some risk that they're going to bring it in. When you're at work and there's 20 people in an office, the risk is going to be greater that somebody is going to, be able to shed the disease and transmit it. But we do know, for example, in the hospital, when we're actually taking care of people who have disease and so on, we're able to use good precautions and so on and have very little transmission in the hospital. Actually, no transmission from sick patients, knock on wood, in the hospital. So but that can occur. It can occur at work. And I think the risks are all really dependent on how good the control measures are at your place of work.
So less about the air circulation system and more about our behaviors again, or how many people are around.
Absolutely. Okay. I mean, I think, you see people in small rooms and they're sitting next to each other with their masks off, drinking coffee and chatting. That's the way we used to live. I think right now we can't do that. If you do that at your office, that is going to increase your risk. Mm-hmm. Good ventilation is actually beneficial. The more air exchanges you have, the less likely it is that there will be viruses building up in the room where you are if there's a person who's exhaling it. So we don't have any real evidence that it's spread through the air conditioning system. In fact, most air conditioning systems in buildings will reduce rather than increase your risk of getting infected because they're vented to the outside or they're circulated through HEPA filters and so on. I think there has been one report where people showed people sitting at tables, quite far apart who had been infected, and the air conditioning system was, somewhat implicated in that. But it's not because they were sitting downwind of the jet stream from a vent, not because the air conditioning was actually spreading it through the restaurant. Okay. It'd be as if I had a fan behind me, I was infected, and it was blowing towards you. So the short answer to that is we don't know. What we do know is that at least in some people, there are markers in their blood that suggest that they would be protected. How long that protection might last, we don't know, and how protective it is even, we still really don't know. We don't have any firm evidence that people are getting reinfected to date.
There's so much about this disease we still just don't know, right? So
right, and I think that sometimes when people are very sick and they're convalescing, recovering, they may have a setback and sort of have a relapse of symptoms, particularly if they've had very bad lung disease, and that doesn't necessarily mean that they got reinfected. So there's some of that to confuse the issue even further.
right.
The USS Roosevelt, where a very large number of Navy personnel were infected on board that ship, there were some people who had recurrent symptoms, and that was adduced as evidence that maybe they were reinfected. But I think that is not at all clear. Mm-hmm. To further confuse the issue, even if you're completely recovered and you're not infectious, you can still have a positive test for quite a long, long time, we're finding.
Oh.
And, because the test is not measuring live virus, it's just measuring the viral genetic material, it's RNA, and that can persist for weeks. So we generally are not retesting people once they're clinically better, once their symptoms are gone, they don't have a fever, et cetera, because that test may be positive, but we don't think that they're capable of any longer transmitting the disease. Dilute bleach will work very well. It has to remain on the surface for a short period of time for it to be 100% effective. And 70% alcohol or rubbing alcohol, ethanol will also work. And those are the main disinfectants that are safe to use. Again, of course, bleach isn't safe to use except on surfaces, and can be damaging to eyes and skin and so forth. And you should be careful when using bleach and not use it any stronger than the recommended dilutions. I think, but it is convenient to be able to use cleaning wipes and so on for, like countertops and so on. You could do it with soap and water, but again, you would have to essentially rinse it and wash it, and sometimes that's not convenient for some surfaces, especially those that, might have electronics or other things that would be damaged by immersion in water.
Sure.
I think the majority of people will develop symptoms before that period of time. The median time from infection to symptoms, we think, meaning that about half the people will take longer and half the people will develop symptoms a little bit shorter. It's about 5 to 6 days.
Okay.
The further out you get from 6 days, the less likely it is that you're going to develop the disease. But I think to be 100% certain, so for example, let's say that I was exposed to a patient inadvertently who turned out to be positive. Let's say that a patient came in, they hadn't been ruled out and weren't suspected of having it. I went in there and spent a lot of time examining them or something, and then they started coughing the next day and were tested positive. I would have been exposed. Ideally, we would ask people like that to stay home for 14 days before they come back to work to make sure that they won't develop disease. That period can be shortened to 10 with daily monitoring of symptoms and so on. But I would say after 10 days, it becomes very unlikely. By 14, virtually not likely at all.
Okay.
we're saying that movie theaters can open, restaurants can open, churches can open, et cetera, because we want people to be able to have some semblance of normality return to their life. That decision increases your risk. Okay, I don't want to leave people with the impression that it's now safer to go to a movie theater than it was before. It's never without risk.
And it might be more dangerous now because there's more virus in the community.
Because
perhaps.
there may be more community transmission. So are they really safe? It depends. You know, anytime you go into a closed space with other people and multiply the number of people, the smallness of the space, and the length of time you spend in there, those three factors will increase your risk. The smaller the space, the less the ventilation, the more people that are in there, and the longer time you spend in there. It's sort of like that's the net product of your exposure. Mm-hmm. And so if you go into a movie theater and you watch a 3-hour movie with a bunch of people, even if you're 6 feet apart and they're only letting people sit, you know, in every so many seats, your risk is greater than if you're taking a walk in the park. Stands to reason. Same thing is true with a restaurant inside. You know, you're in closer contact with people, your server, other, you know, diners, than you would be if you ate outside or ate at home. But it's all a calculated risk. You know, you try to go to a restaurant, sit far away from people. You know, the waiters are masked and so on. You know, if you were in a choir and you were standing next to somebody and you were singing, that increases your risk a lot if one of the people in the choir were to be positive, which is why I think most churches are not doing that right now. You know, but anytime you're in a closed space with a lot of people, and if you're participating in any activities that might increase the risk of your exhaling particles if you're infected, there's a certain amount of risk. And it's all a balancing of those risks and trying to minimize them. I think, you know, we said a little bit earlier that 6 days is sort of the median time to developing symptoms if you're going to develop symptoms. You may not, like we talked about before as well. So there's sort of a curve of time after an exposure. So let's say you got exposed at the protests. You would expect to start seeing cases as early as 3 days after your exposure and out to maybe 14 days. But most of those cases, if they were going to develop symptoms, I would expect within a week or so. Now, again, a lot of people don't get to the medical system until they've had symptoms for a few days. You know, if they were very responsible, they would say, well, I've got a cough, I'm not going to work, I'm going to call my doctor and find out what to do. And if their physician decided that, and they decided together that it didn't warrant coming in and possibly exposing other people, they weren't that sick, they would be advised to monitor their symptoms, take Tylenol, monitor their temperature or whatever. And so many of those people may never even get tested, okay? If they did get tested, they might still end up staying at home. Or they may never even call their physician because they're not that sick. But we would expect to start seeing cases earliest, I would say, about a week from the time that happened. Maybe even as soon as 3 or 4 days. But most of them would be after a week to 2 weeks. So I guess, you know, right about now is when you might start to see an increase in cases. Right. I'm not sure there's a good answer to that. I think it's a very unpredictable situation when you're on the street with a lot of people. And, you know, we've all seen what kinds of things have been happening. So you might be, without meaning to, be stuck in a very closed space with a lot of people. And shouting and yelling really generates a lot of particles in your expired breath. So there's that. And even with a mask, if you're close to somebody, it's not 100% by any means. So certainly keeping a mask on all the time would be very helpful. But you can't, in that kind of uncontrolled situation, you can't control what other people do. They may not be wearing a mask. You may end up finding yourself in a situation where your risk is quite high. Certainly people who are arrested and maybe put into a confined space with a lot of other people for a protracted period of time. And so I think that it is certainly, increased risk. And I think if you're in a high risk group, for everybody, any activity is a risk calculation. And going to the grocery store involves some element of risk. And so you do everything you can to mitigate that risk. If you're very high risk, you probably shouldn't go to any of these things at all, if possible.
Or have somebody in your life that's high risk that you're cohabitating with, or you work with high risk individuals.
Yeah.
Might be a consideration.
Yeah. So I think, these, but I would say that, going to a protest, you have to be realistic about the risk. If you are, immunocompromised, if you're elderly, if you have chronic lung or heart conditions, if you have diabetes, if you have, moderately severe asthma or other lung diseases, those are all conditions that would increase your risk, and you should, be aware that your risk is higher than the average person and the younger person, for example. I think whatever shape the return to classes takes, it's going to require continuation of these sort of interventions, masking, hygiene, and so on. Because, this isn't going to miraculously go away between now and when school is supposed to start. So I think that on the one hand, most young people are relatively low risk of serious illness or death. That said, when you have tens of thousands of students, there is going to be a significant number of students who are high risk. Not every young person is completely healthy and risk-free. There are students who have diabetes and other, immune suppressive conditions. They may be on medications for some illnesses that suppress their immune system. Some of them may even have cancer, type 1 diabetes. They may have severe asthma. And so there are young people who are going to be at risk. And their educators, the elderly faculty, teachers, and so on, also may be at higher risk. So we're going to have to take measures to try to protect people as much as possible. And I think most institutions are also thinking about measures where there can be some hybrid of in-person classes and online instruction, so that the classes where it's really important to try to have some hands-on learning, laboratories, for example, might still proceed with some precautionary measures in place. I think there should be attempts to minimize high-risk transmission settings, like people sleeping in the same room and that kind of stuff, high-density housing, and also trying to minimize movement in and out of campus. For example, going home on a break and coming right back from all over, the country or the state is going to increase transmission in and out of the campus. So I think it's going to be difficult, but I think most institutions are going to try to restart and strike a balance between safety and shutting down our whole educational system, which I think is really not, going to be feasible, obviously, long term. Well, I think that generally speaking, no governmental directive is going to be successful without the support of the people. Mm-hmm. That said, I do think that we should emphasize that the government, public health officials, physicians, nobody is saying that we don't have a responsibility, each and every one of us, to do whatever we can to prevent spread. I mean, what we do for our fellow community members, is ultimately to our own benefit as well. I mean, it's not just, I'm not worried about getting sick. That may be true, but ultimately, every little bit that I can do, that you can do to minimize spread, is one less person who's going to get sick enough to go to the hospital or to even die. And it is personal responsibility, as you say, but I think the government has made it clear that we need to do this as a community, and I think masking is one example. It's not foolproof. It's not 100%, but we do know that it reduces the likelihood that you're going to transmit it, and maybe to a lesser degree, it reduces the likelihood that you're going to get it. Okay, so there's these great apps that you can find online where they simulate what happens when a certain percentage of the population wears a mask, if it's 10% effective or 50% effective, and then they introduce an infected person into that population. It's like a little Pac-Man room, with these little people moving around. And it's really remarkable that, you can set the slider to 10% effectiveness of masking or 50% effectiveness of masking, but you can see that the infection never takes root and it dies out sooner the less transmission there is.
Yeah.
And it's exponential. If 20% of the people wear masks, it's more than twice as good as if 10% wear masks. 70% of the people are wearing masks, it's very difficult for the infection to spread. If everyone is wearing a mask, it really seems to reduce spread. Even though we don't know how effective it is, it's certainly not 100%. I think it is useful for us as much as possible to be doing that when we have to be closer than 6 feet. If you're outside and you can be sure you're not going to be near any other people and you're just taking sitting in the park by yourself, that's fine. You don't have to necessarily be wearing a mask. But, and like I said, we're going to put our mask back as soon as we stop talking here.